This to all the dentists who are practicing implant dentistry. I quite often get asked, either through DMs or messages, or personally, people do ask me these questions regarding dental implants. One, the longevity of the implants. Two, how to make sure that the implant procedure is successful. That means they're talking about failures in implant dentistry. And one more thing which I've seen where people repeatedly ask me is how to make sure that the smile looks true to life with implants. Now, I believe as an implantologist who's been working for the last 2.5 decades, I do not consider failure as a term in implant dictionary. So when I say this is not out of overconfidence. This is my expertise in the last 2.5 decades where I have evaluated every single step of mine, where I have been self-critical about my work. I believe for any dental procedure to be successful, there are 3 things which would matter. One is the skill of the dentist. How good you're refining your skill determines how your treatment is going to be. And for you to refine your skill, you need to be self-aware of what you're doing. Are you doing that? If your skill set is really refined, there can never be failures in any of the treatments, forget implant dentistry, right? Second thing is the know-how of the science of the procedure. Or are you following the absolute protocols of that particular treatment? Many a times what happens is, let's say we are talking about even a composite restoration. Are you curing that cement for 20 seconds, 10 seconds as prescribed by that particular composite? Probably not. That's why you have a failure. Failures wouldn't happen if you know the absolute know-how of the science of that particular procedure. The third one is technology and technique. Now, technology. When I talk about implant dentistry, how many of you know the entire armamentarium of implant dentistry? Do you know the entire catalog of components of implant dentistry? Do you know all the possible applications of these components? I've seen that most of the doctors who are practicing implant dentistry are hardly using multi-unit abutments. There are implants where I am shocked to see that people are placing 12, 13 implants just in the upper arch, and again some 12, 13 implants in the lower arch. These are things which would cause failures. So if you know your technique and the technology, if you know the components well, how can there be failure? Failure is one way you don't know the reason a particular treatment wasn't successful. But if you know that it happened because of your lack of skill set, it happened because you didn't know the absolute know-how of the surgery, or if it happened because you didn't use the right applications or components or the right materials for that particular procedure. So I believe if you want to refine your skill and if you want to deliver infallible dental treatments, it's imperative that you know the science behind the procedure, you refine your skills, and also know the entire armamentarium and components of that particular procedure, which you will utilize to benefit the patient and make sure the longevity of the treatment is infinite. Thank you.